Okay, so what I'm about to show you is working on Xander and treating Xander for the night. Xander was attacked by his mate, and he suffered from a pretty large laceration on his chest. So we've been having to treat him after he got surgery to close up that area, and we've been working on preventing infection. During this process, he's had to be kept by himself because when they have a wound, they need to be separated so that they don't have their mate open up a wound or accidentally cause more damage while they're trying to groom each other and so forth. So he's been by himself for just over 2 weeks now, which can do a lot. This is part of why we say you need to have a pair of gliders, if not more than two. As a result of him being alone and being isolated, he is becoming depressed. Unfortunately, with his wound, we've had to restrict him to a much smaller cage. We don't really have any toys in there because we didn't want him catching anything on the stitches on his chest. We didn't want him getting injured on stuff, and we wanted him to restrict his movement because the chest area right there by that patagium is a high range of motion area. So the more he was moving, the more it would pull on the stitches and the less likely it would be for that tissue to come together and heal properly. So right now he's going through what's called secondary healing. Secondary healing is where it's going to be healing basically from almost the inside out. And there's a lot of granulation tissue that has to build back up because when they did the surgery and pulled the tissue together, unfortunately, because it's in the high range of motion area, that where it would have been the nice clean edges, they started to pull apart, creating a gap, and they dehisced. So now we're having to kind of create that new tissue and get that built back up. So he just got a bath because as a result of him with this injury, he needs to be in an e-collar, and the e-collar prevents him from being able to groom and take care of himself. And he was getting really dirty. The antibiotics were giving him diarrhea. He couldn't reach any of his areas to clean, and so he was in desperate need of a bath. I have another video I'll be uploading that shows bathing an adult glider. So right now he's currently in the bonding bag with some extra fleece. What I'm going to do is I'm going to take him out. I'm going to give him his medication, kind of try and dry him off a little bit more thoroughly. And I'm going to also treat the wounds that he has. With the being isolated and depressed, he has been going after the tip of his tail, and he's been mutilating the tip of his tail. We tried switching e-collars. He had been in a silicone cupcake liner e-collar prior because this original satellite e-collar was creating some wounds around his neck. So we had switched to the silicone cupcake liner. He could reach his tail with that, so we switched back to the satellite e-collar, but unfortunately he can still reach it. So we're going to have to treat that wound as well so that he doesn't continue to overgroom the end of his tail and cause more damage. That could potentially lead to another surgery or an amputation. So I've got some things here to help with that process. So this is what he was in, something similar to this. Now, he wasn't in this one in particular, but he was in a cupcake liner like this. I'm going to try and switch him to a different satellite e-collar than the one he's in right now, because the one he's in, he's been in it for a while, but it's got almost like a rubber neck. It's meant for birds. And so while it's great because it's a clear, stiff plastic, the inside portion is what is rubbing his neck raw. So I'm hoping that maybe switching him to something like this where it's got the moleskin will be more helpful. Before we put on his e-collar last night, we switched it to moleskin, or at least covered that rubbery part in moleskin in hopes that it won't do the damage. So hopefully his neck is looking a little bit better. What I have here, I've got his antibiotic. He is on sulfatrim right now. And then I've also got some meloxicam to help with the pain. I also have SSD, silver sulfadiazine cream. This is a prescription-only medication that my vet has given us in the past for other wounds like this. We've had mating wounds we've had to deal with in the past. So we were applying this to his chest, and I'll also apply a little bit of it to his tail as well to make sure that we are giving him the best chance to recover as fast as he can. I also have just some extra paper towels, just some fleece to make him more comfortable, some vet wrap to wrap the sterile gauze and hopefully keep that attached to his tail. So he's not happy because he just got out of the bath. Hi, buddy. You want to come here? I also have several treats here to try and entice him to behave the best he can. Come here. So this is Xander. He's wet right now, well, like moist, but hi. Oh, I know. Here's your treat though. What he's doing, that little shake you see, he is trying to get the e-collar off. Come on, bud. So I'm just going to try and dry him a little bit better. I'm just kind of gently squeezing the paper towel here to help kind of dry him off. He's been really, really good about getting a bath. Part of the reason I'm giving him a treat as well, he hasn't had his dinner. And because he hasn't had his dinner, he doesn't have anything in his system for when I give him the anti-inflammatories. And anti-inflammatories can be really rough on the stomach. I'm just going to take a look since I can actually see everything. It looks like he's just gotten just a little bit of the tail. There's no bone exposure or anything like that. So that's the best case scenario there. So, oh, buddy. So I'm just going to keep drying him off a little bit. And I'll try and see if I can get him to let me show you the wound here. Hi. Can we show them? I know. I have to kind of dance around with him a little bit because he's stressed and I don't want him to feel too confined. So what I'm going to try and do is get my hands underneath the e-collar. See if I can. I know, bud. I keep getting so close and then you snatch me up. Okay, so you can kind of possibly. I know. I'm going to have to do this without the fleece. I can tell. Yep. So you can kind of see the wound right there. And it's pretty large. It actually looks really, really good compared to what it did look like. So I'm going to go ahead and just put a little bit of the silver sulfidizing cream on that area. Hi, buddy. Hi. Hi. We've got to give you some meds. So the benefit of him being in an e-collar right now is that I can kind of manipulate how I hold him and kind of, in a sense, pin him to a spot that I want him at if I can get him to stop gripping my gloves. Here we go. So there's the pain medicine. I know, it's just no fun. And there is the regular antibiotics. Yeah. So what I'm going to try and do is I'm going to go ahead and take off his previous e-collar. Oh, I know, you're trying to take off on me. I'm trying to give you a break. Yeah. Look at that, bud. I'm going to try and take a look at his neck because, like I said, the previous e-collar was kind of, I don't think I'm going to be able to show you very well. The previous e-collar was rubbing on his neck, and it was basically rubbing the fur off and rubbing his neck raw. I mean, it looked painful. I can't imagine how it felt. So I'm just going to put a little bit of this silver sulfadiazine around his neck too. That just again helps with the skin healing process as well as keeping everything clean. Oh, I know. Oops, that just stuck to the paper towel, didn't it? So like this. Get it on, yeah, I know. Okay, so I've got that on him. Are you trying to disappear back into the bag? You want a break for a second? So I can't leave him too long because I don't want him to cause any damage. But you can see that the moleskin obviously wasn't working being up against the background of this here. I'll show you kind of what they had. This is obviously the best they could do. I mean, it's not like vet offices are equipped with glider e-collars or anything like that, but you can see the black here, and that was just rubbing raw. Hi, buddy. So, let's see. Next step, he's got his meds. Okay, buddy, are you ready to try for another e-collar? I should have probably put the other one on behind that one, but nope, we're not going to clean that. Thank you, though. So, let's see. He realizes. He's like, I don't want this. I might actually have to get a second pair of hands for this one because I don't know that he's going to let me do this on my own. I just need to see if this is going to even block him from what I need. What I need is for him not to be able to reach that tail. I don't know if that's going to necessarily happen with this here. No, we're going to leave that tail alone, please. We're going to leave that alone. Yeah, we're going to leave that alone. I'm going to get a second pair of hands, and I will be right back. Okay. Oh, nobody. Okay, so let's try this again. We're going to go ahead now that we have the second set of hands and get him into an e-collar. Nobody. I'm going to kind of wrap him up here and allow his head to kind of poke through. Does it feel like it's going to be tight enough without being too tight?
I think so.
Okay.
For sure. Good. I'll stick something right there. Probably.
Yep, not tight enough.
No.
I know, buddy. I know. You just want to get at that spot. Let's try this again. I know. No, we're not going to get at that spot.
Oh, not tight enough.
I'm just going to tug on it a little bit, and I'll let him try and get out of it for a second because I think it might need
As long
to
as you can breathe fine.
Yep. So whenever you put an e-collar on, you want to check their nose. If their nose starts to turn purple, they're not getting enough
This has enough looseness. I can clearly see
oxygen.
that you should be okay.
Yeah. You look like you're doing good.
So you tighten it up a little bit if you need to.
I'm afraid he's gonna squeeze out of it.
Yeah.
Yeah.
Grip on him and then.
Yep. Let's get up just a little bit tighter, I think.
Back.
Oh God, I know.
Okay.
Better?
Yeah.
And then I can
Well,
stick
yeah, we'll add
something
something there
right
as long as
here.
it's
Do you want
good.
to clip a piece off there? Right here's some scissors. And we'll just put it right over that top. I know, bud. You're just trying everything to get out of this. I know. Basically lock that into place. Okay. So, now that that's on, I'll let him kind of hang out in here. for a second. We'll give you another treat, since he'll be face down. That might keep him busy while I work on his tail here. So, actually looks pretty good. There's just a little bit of junk in his tail right here, but I think we should be okay. So what we're gonna do is we're gonna take the sterile gauze, and I'm gonna probably have to have you hold him, Justin.
Gloves then.
Yeah, I'm gonna grab gloves, keep him as clean as we can while he's just going to town on that yogi back there. Wondered if we can get him out to a yogi out here. Here you go. Just so I have a little, oh yeah, nomming noises. Nom, nom, nom. Hey, right here. Right here. See? Here we go. I just want to hold on to him. And what I'm going to do is I'm going to take this sterile gauze. I'm going to place it around the tip of his tail here. And the trick is going to be tight enough that it stays on, but loose enough that it doesn't cause circulation issues. So let's give this a shot here. Go down and then we'll come back up. He's trying to twist his tail so that I can't get to it.
He's just trying so hard to reach the yogi. Here. Oh, oops.
Kind of loosely hold it so I know he's not gonna accidentally pull it out from me here. Vet wrap sticks to itself. Oh my, the pony is very angry. So vet wrap sticks to itself, so I don't have to worry about an adhesive there. Looks like I'm just gently tugging on it. It looks like it's gonna stay. Do we have any more of that moleskin at all? I think not. Really big deal. What is that? Just gonna clip a teeny tiny bit off here just to close off the end of this. Let's see, funny gloves. Just so nothing soaks into that gauze pad. There we go. Okay, so is he still eating the yogi?
I gave him the second one
Okay.
here, and
He's enjoying himself.
a little bit up. Yeah, there you go.
Okay, bud. So now we have a glider who is freshly bathed in an e-collar. Tail is wrapped so that he cannot cause any more damage. And we just got to keep an eye on him, make sure that he dries out, and then he gets to go back home for the night. So yeah, hopefully that was helpful. Here you go, bud. Come on. Let's go in here. All the way.